Chlorine. Chlorine is a chemical element. It is a yellow-green gas under normal conditions, and it is 2.5 times heavier than the air. In nature, it is usually found in chemical compounds such as numerous salts. It is used in chemical industry and serves as water disinfectant in swimming pools. In living organisms, it is physiologically present as chloride ions. It also arises as elementary chlorine in very small concentrations. Chlorine intoxication is usually accidental. It can be occupational, in industry, or transportation. It can arise after misuse of domestic cleaners. It can happen when you mix an acid-containing cleaner with bleach sodium hypochlorite, or during chlorination in swimming pools. Chlorine intoxication can be occasionally intentional, such as a chemical weapon first used during World War I. Chlorine solubility in water is intermediate. Both proximal and distal parts of the airways can be injured after exposure. First, mucus of the nose and throat and eye are irritated. When this happens, you must escape from the contaminated zone. Distal airways damage and its extent depend on exposure duration, gas concentration, and depth of breathing. Mechanisms of chlorine toxicity is based on its reaction with water on the surfaces of the respiratory tract and eyes. This reaction produces hydrochloric and hypochlorous acids. The hypochlorous acid decomposes into hydrochloric acid and an oxygen-free radical. Both acids and oxygen-free radicals react with the surrounding biomolecules. Main clinical symptoms of chlorine intoxication are cough, upper airways, and eye irritation, chest pain, and breathing difficulties with wheezing. Nausea and headache are also common. Skin irritation is less frequent. Low chlorine exposure generally results in little or no permanent consequences. Heavy chlorine poisoning causes severe alveolar inflammation and pulmonary edema. It can be fatal. Chlorine concentration above 400 ppm leads to death within 30 minutes. Treatment of the chlorine intoxication is based on evacuation and decontamination. Treatment is generally supportive and includes breathing of humid oxygen, a beta agonist for bronchospasm when needed. There is no antidote for chlorine poisoning.